There are caregivers who genuinely love the people that they take care of. I know that there's often a stigma of living in one of these communities, and I just encourage those that feel that way to go out and visit your local nursing home or assisted living community. They've changed quite a bit from the 80s.
Welcome to our Recur Effect podcast. And today we've got Allison Spangler. And Allison, I'm just glad to have you on here. I was beginning to worry that it was just going to be me today talking to myself, but I'm so glad that you're here. And we haven't really met, so I don't know a whole lot about you and the Utah Healthcare Association. And it's got another name as well. Can you kind of tell us a little bit about you and the Healthcare Association?
Absolutely. Well, first of all, thanks for having me. I'm super excited to be here. I'm glad that we can have a chance to talk. And I always love talking about Utah Healthcare Association. So we have been around for 50 years.
Wow.
We originally started out as a nursing home association, and in the last 50 years, we've broadened into other scopes of membership. So the other name that we operate under is Utah Center for Assisted Living, because we also serve assisted living communities as well as care facilities for intellectually disabled. I personally have been with UHCA for 10 years. I have a huge passion for long-term care and for caring for our aging seniors in the state of Utah. And our primary role at Utah Healthcare Association is to serve our members, and we do that several ways, through education. We do it through political action and advocacy. We work very closely with policymakers and regulators. We are often working on reimbursement issues with Medicaid or Medicare. Anyway, just anything that we can do to help support our members. That's our job.
Fantastic. And you are the president, is that right? You're
Correct.
the
Yes.
president. How long have you been the president?
So I took on this role in 2021. So just over 4 years.
Wow. And are you volunteering for this role, or is it a paid role, or?
Yeah. So I'm full time with the association. So it is a
You are.
paid role. Yes.
That's
Yeah,
fantastic.
we have a board that governs the association, and then we have staff like myself that run the association.
A lot of associations that we work with are all volunteer ran. So it's good to have people full-time running it. That's
Yeah,
great.
there's definitely a lot of need, especially in the senior living space with policy and reimbursement. So definitely a big need for full-time staff.
Where's your office at? Where do you guys run out of?
Our office is in the Murray area.
Murray? Okay.
Mhm.
And tell me who you're looking for as far as who you think would make sense to be a member of your association, and how do you attract them?
Yeah, absolutely. So we are very fortunate, and all the nursing homes in the state of Utah are members of our association. So we're very grateful to have made that milestone. And we also have all of the care facilities for intellectually disabled in the state. So our biggest area of growth right now is on the assisted living side. So there's a huge opportunity there for membership and for growth. There's a lot of senior living communities that have popped up in the last few years. I'm sure you've seen many of those are being built to accommodate this silver tsunami that's going to be happening over the next 5-10 years. So that would probably be our biggest opportunity for growth, is the assisted living side. And we've recently hired some new staff that their role is to manage our assisted living providers and to help keep them happy, make sure we're serving them, but then also to grow our membership.
Fantastic. So if somebody starts a new assisted living center started here in the state,
Mm-hmm.
tell me how they would get a hold of you guys, and tell me just a couple things about them. Why would they want to come be a part of your association? How can they be a part of your association? And then also, what does it cost them? And then what does it provide for them?
Sure. So we, couple things. I think people can find us probably the easiest on our website. So www.uthca.org. That's probably the easy. Yep. I know, kind of a mouthful. uthca.org. So that's our website. That's probably the easiest way to get a hold of us. Anyone on our team, ask questions or reach out to us. What we offer. So aside from the things that I already mentioned, I think We have been around for 50 years. We are a very strong association. We have the resources and the ability to have a really strong presence on Capitol Hill. We have a very strong and involved national association that we're also a part of, which I think is really unique, especially on the assisted living side. We're a part of American Healthcare Association, but they also have the National Center for Assisted Living. And that association within the umbrella of AHCA is very strong and powerful, federally on Capitol Hill, and they have amazing resources and things that we can offer to our assisted living providers that I think others just can't because of those resources. So I would say, that those are probably our top reasons. We have amazing staff. We try to be very involved. We get out in the communities. We have been doing a recent project called Stories of Caring, where one of my staff members has been going out to assisted living communities and taking videos of staff members, and we've been compiling them and putting them together just to show the general public and the community why caregivers like to work in long-term care and why it's meaningful and why they choose to stay. Not easy jobs. So those are just some of the things that we do for our providers.
Nice. And I know I asked you a slew of questions here, and we're going to get through all those. But you mentioned your staff. How big is your staff, and how many do you have working for you there?
Yeah. So we have 3 full-time staff. That's including me, and then
That's
we have 1 part-time.
okay. And as you continue to answer these things that we're interested in, is how can like the general public help you, and do you have volunteer opportunities for things that you do, and as you're continuing to tell me more about how people might join up with you. So
Yeah, I think our biggest areas for volunteer work within the association is during our conferences. We're always looking for people to come help us. Putting on events is no easy feat. And with a small staff, we're always looking for people that want to come and be on site. And it's a really, it's a win-win. It's a great opportunity for the person that's volunteering to network with our members, to get a chance to meet providers, meet people that could be their future bosses, or, anyway, do business that way, meet with vendors. So that's probably the biggest way that people could get involved and volunteer within our association.
probably the reason I asked that is because I've got a couple of grandparents that are in assisted living, and my family and I would probably be interested in helping somewhere somehow with that kind of a scenario. So that's why I asked that question. But you probably get that a lot as far as people connecting to you that way.
Yeah, absolutely. We love when the public calls us and, we'll get calls saying, we've got these quilts we want to donate, or we've got extra this or that. And so we love connecting them with our members in the community that, can always use those things. And, if is anyone that ever wants to get involved in an individual facility in their area, we can definitely connect them as well if they want to go in and help with an activity, or they want to bring kids in to sing, or whatever it is that just makes the residents' days. So we love to help with that.
I love it. And so you were talking about your conference or your
Mhm.
conferences. Do you tell us more about that and when it is, and what that consists of?
Sure. So education is a really important part of our association. We want to make sure that our members are kept up to date with what's going on in the industry. They also have some requirements for continuing education. And it's also a good revenue source for our association. So we host 2 large conferences a year. We just had one a couple of weeks ago at the beginning of October. We usually do a golf tournament to kick it off.
Oh,
That
nice.
golf tournament benefits our political action committee, and then we have a 2-day conference after that where we have fun keynotes. This year we had a mind reader come, a mentalist, and then
Where did you hold your conference at this year?
we host it at the Mountain America Expo Center for our
Oh,
fall conference. Yeah, and then we usually have around 80 to 85 companies come in and exhibit. So we have a trade show and an education component.
oh,
It's just a really good opportunity for our providers, our members, to network and to, swap stories and share best practice. We had a really good panel this year of
wow.
people from our board just talking about the industry in general and their life as a leader. So we try to be really innovative and bring people in nationally to come and speak and address current events and things that are going on. And then we also have a spring conference that we host in Southern Utah in St. George. Really fun for people to get out of the snowy northern Utah and head down south for a couple of day conference. And it's a leadership conference, so it's usually focused on senior leaders, executives, the directors that are running the facilities.
If I want to attend your conference, what does it cost
Mhm.
to come and attend? And
You know,
how would I do that? Just go to your website and register for it?
Yep, yeah, really easy to do on our website. We allow non-members to come as well. So even if you're not a member, we'd love to have you come and participate in our conferences. And the cost is it really varies between event to event and location. So it's hard to pinpoint just one cost, but always happy to make a deal if we need to.
Gotcha. Gotcha. And as far as kind of getting the word out, I know that you said that you're kind of growing into the assisted living area.
Mhm.
Mm, What can we do to help get that word out to assisted living centers that maybe aren't part of your association? Or what's your biggest obstacle that you're looking to face here that maybe we can talk through just a little bit?
Yeah, I think associations are not mandatory. They're all voluntary. So it's really shifting the mindset of the people that own or are running these communities to understand the importance of an association and why they could use an association on their side. So I think that's probably like one of our biggest barriers is just helping us these providers understand that. And I think the assisted living side is so different than the skilled nursing side. They are oftentimes very small, independent owned providers that maybe don't have the resources of a larger provider. And a cost of a membership could be difficult for them. So I would say that's probably another barrier. But for us, we just really want to uh, keep doing what we're doing and show the community the service that we can provide. And so, if you ever come in contact with anyone that owns or runs an assisted living, we'd love for you just to send them our way so that we can have the chance to prove that to them.
I'm assuming the big healthcare companies in the state are members of your association. I don't know the answer to that, but I'm assuming.
Um, Definitely on the nursing home side, because we have all of them. On the assisted living, we do have a couple of larger assisted living providers. But like I said, that's a newer focus for us that we're trying to grow. There is another association that just serves assisted living communities, which is fantastic. I think as long as a community is joining an assisted living or any association for that support, it's really helpful. So.
Fantastic. And is there anything you want to kind of get out there that you want people to know about you or the Utah Healthcare Association or the Assisted Living Association?
Yeah, I think just continue to remind people that long-term care is an amazing place to live. It's an amazing place to work. There are caregivers who genuinely love the people that they take care of. I know that there's often a stigma of living in one of these communities, and I just encourage those that feel that way to go out and visit your local nursing home or assisted living community. They've changed quite a bit from the 80s. A lot of them have been remodeled significantly, or on the assisted living side they're brand new builds, and the person-centered care and the things that they do in their facilities I think have really leveled up what's provided in the facility. So don't be afraid of long-term care. If you have to place your parent, your loved one, or if you yourself are having to enter into one of these facilities, I assure you that there are great caregivers out there and people that are ready to ensure that your needs are met.
That's fantastic. Well, I just want to take a minute and tell you thanks for coming on. This is just a pretty short little podcast. We're getting to know a lot of associations, and you guys are actually probably one of the bigger ones here in the state. And it's a pleasure to get to know you. And I'm really rooting for your association just to continue to thrive as it seems like they're doing. And from Recur, we appreciate your support and your partnership. So thanks so much for just being on here today. And it's just a pleasure to get to know you. So
Thank you. We really appreciate the support, and you guys have been great to work with. So thank you for making it seamless.
fantastic. Thanks, Allison.